My name's Adam Brinkman. I'm one of the pediatric surgeons, but I'm also the pediatric trauma medical director for the American Family Children's Hospital and UW Health.
Great. Simple one, I guess, to start. What is Ask Day? What's this all about?
Yeah, so Ask Day stands for Asking Saves Kids, or ASK. It's a day, June 21st every year, that the American Academy of Pediatrics is in support of, but it's asking the question about firearms and firearm safety. The premise behind it is that asking about that helps keep kids safe in their environment, prevention of firearm-related injuries. And so it's just a yearly reminder to ask about guns and gun safety to keep our kids safe.
But what do you see on a daily basis and kind of how that relates to Ask Day?
Yeah, so in addition to the bread and butter things that I see as a pediatric surgeon, like appendicitis or babies with inguinal hernias, we take care of children that are traumatically injured, everyone from 0 days of age up until 18. Most of those injuries are related to bicycle accidents or motor vehicle collisions, falls, but alarmingly we are seeing more violence in terms of penetrating trauma. So things like stab wounds, gunshot wounds tend to be the things that we're seeing. And so as a pediatric surgeon and trauma surgeon, myself and the team that I work with is responsible for taking care of those children.
What are some ways that parents can approach this subject with another family? Because they might not know whether they have a gun or not. So, like, what can that process be like, and how can parents do this for the first time?
Yeah, it's awkward. Like anything you do for the first time, it's awkward. So actually, the words coming out of your mouth can be really challenging. I usually recommend starting with one simple question, and that's, is the environment your child or the child you're caring for plays in, is there a loaded or unlocked gun in that environment? If that's too much to remember or too hard, something as simple as, do you have guns in your home? Follow-up questions to that is, where are they kept? Are they unloaded? Are their bullets and guns kept separately? Are there locked boxes for both of those? And again, the first time you say it, it seems awkward. But my advice to parents is, we ask about things like, do you wear helmets when you ride your bike? Is your child afraid of dogs or animals? Do you have a pool, and does your child know how to swim? Do you have food allergies, or does your child have food allergies? Those are all important things that we ask about. Asking about guns and gun safety and where guns are kept and how they're kept should be a part of those questions when children are playing with peers or friends or at other families' houses. Our number one goal as parents and caregivers and healthcare providers is to keep kids safe. One way that we can keep kids safe in their environment is to keep guns and bullets safely stored. And by far and away, the best way to keep bullets and guns stored is separate, with the guns unloaded, both in locked cabinets that only adults or caregivers have access to. Children by nature are curious. And as they gain more physical independence, they can find things. So that gun that you have hidden in the top of the closet under a stack of sweatshirts is probably not as hidden as you think. And kids are curious, and we want them to be curious. That's how kids grow up to be exceptional adults with great thoughts and make changes to this world. But we need to keep them safe. In doing so, we need to keep our bullets and our guns separate. Oftentimes we talk about giving helmets to kids who are riding bikes or putting a fence around a pool. Well, making sure that the bullets and the guns are kept separate in homes is also important. Here at the American Family Children's Hospital, we have the ability to help our community by providing educational materials in terms of the safe practice and storage of guns and firearms, but also have the ability to give away gun locks. The icing on the cake, in addition to keeping the bullets and guns separate in locked cabinets, is to have a gun lock on your gun or on the gun in the house. Oftentimes these can be commercially, or they are commercially available at the time of purchase of the gun. But if for some reason a gun owner is unable to obtain that gun lock for a variety of reasons, well, then the American Family Children's Hospital is a resource for those individuals to obtain a free gun lock to keep our kids safe and out of the hospital. At American Family Children's Hospital, as many other children's hospitals throughout the United States, are seeing more and more children be victims of firearm and firearm-related injuries. And this is not just an urban problem. This is not always homicide or partner violence. This is oftentimes happens at home with a family gun, and oftentimes to a family member. And in American Family Children's Hospital, we have seen almost 100% increase in the amount of firearm and firearm-related injuries that we've seen since 2015. We are in line with prior years in terms of the number of firearm-related injuries that we see. However, in 2023, have already seen 10 firearm-related injuries, and it's just the beginning of June. So those numbers will continue to increase, unfortunately, as we move into the last half of 2023. We teach children about fire safety. We teach children in grade school about fire safety by way of fire drills, and teach them that if they are at a friend's house or caregiver's house and there's a fire, that they need to get out of the house and move safely away from the house or the structure and keep themselves safe. The same thing should be taught to children about guns. And so one clear message to give to a developmentally appropriately aged child is if they do find a gun, to not touch it and to tell an adult or responsible caregiver. While this message needs to be very clear and short, it should be one that should be reiterated many times to a child. Like I said, children are curious. Something new in their environment, they want to explore. They want to touch, they want to see how it works. They want to see what their interaction is and how they interact with that piece of equipment or that new thing. But if they find a gun, don't touch the gun, tell an adult.